Latin American hospitals are facing the tough challenges during COVID-19. Younger health workers are being brought in, but there's a lack of personal protection equipment and basic supplies, as Manu Teradios reports.
The pandemic is bringing to light the different working conditions for medical personnel. In Ecuador, one of the Latin American countries hardest hit by COVID-19, young doctors and nurses are being recruited and housed in places like this hotel, the Corona Real. Here, the prevention measures are clearly defined. Masks, one person per room, and visitors are prohibited. These measures, however, contrast with the situation of these professionals who, despite being exposed to the coronavirus, do not have health insurance for the first 3 months of their contract. They accept these conditions because they fear unemployment more than contagion.
When you first go to work, especially with cases of this disease, which is highly contagious, you go with fear. I think it would be unfair if after 3 months they tell us we're fired.
Officially, Ecuador has recorded 24,000 cases and more than 800 deaths, mostly in the province of Guayas, although many people do not believe the figures. Staff are protesting the lack of protective equipment. In Mexico, health professionals also complain that they do not have sufficient means.
We have come out to protest mainly because even though we're not a hospital that is supposed to receive COVID patients, we are receiving patients with COVID. We have 45 infected colleagues so far.
And then some are targeted by people who perceive them as source of contagion. In recent weeks, dozens of attacks on health workers have been reported in the country. Some have been sprayed with detergents or chlorine, others have been prevented from entering buses or shops, or have been threatened with death. At a clinic in Los Reyes, Michoacán, neighbors threatened to burn people who were being treated by COVID-19. Mexico has seen more than 1,500 deaths and a further 17,000 cases. In Argentina, medical personnel are also concerned about the lack of protective measures.
The same thing is happening in all hospitals. What's going on? There's a lack of personnel, basic supplies and protective equipment.
The country has surpassed the barrier of 200 deaths and more than 4,100 infected. Manu Teradios for Euronews.